Hey guys, just me, Mr. Plazik. What we're going to cover in this particular lecture series, guys, is Chapter 5 of your Human Anatomy Physiology book, which is over the skeletal system. So make sure that prior to you watching this video that you've kind of looked over Chapter 5 in your old Anatomy Phys textbook. And this video is going to help you prepare for your test. Basically, with the skeletal system, you have to know a lot of the naming of the bones. You also have to know the microscopic anatomy of the actual bones themselves. We kind of delved a little bit deeper into fractures, different fracture types. We also looked at joints and being able to measure those particular joints themselves. So this lecture series is going to kind of cover the whole entire skeletal system itself and what you have to know to help prepare yourself for the test. So first thing we have to identify, guys, is the parts of the skeletal system. The skeletal system consists of bones, joints, cartilages associated with those bones, and then the ligaments that are going to attach those bones as well. When we take a look at the skeletal system, it consists of two subdivisions, the axial and the appendicular skeleton. When I look at the axial skeleton is basically, if I draw a line straight down here, sorry, this line's not set straight. But if I draw a line straight down through here, these bones that touch this line are part of your axial skeleton. So your axial skeleton consists of your skull, and then it consists of your rib cage, and it consists of your vertebrae, and then your sacrum and coccyx are included in there. Note that the clavicle's not included. This is one bone you guys get confused. I know technically the clavicle does touch right here, but the clavicle is part of your appendicular skeleton, as well as your scapula. But these bones that are all in blue on this diagram are part of your axial skeleton. The ones that are not blue are part of your appendicular skeleton. Your appendicular skeleton is associated with your appendages for the most part. So make sure on your test that you have a great understanding of bones that are associated with the appendicular and axial skeleton. So what's the major functions of the skeletal system? Skeletal system is going to support the body. It's going to protect soft organs. We take a look at the skull. It's protecting the brain. We take a look at your actual rib cage. It is going to protect your heart. Is going to protect your lungs. Those different types of things like that. Allows for movement due to the attached skeletal muscles. So skeletal muscles attach to bones via a tendon, and then that's going to produce the movement. The bones don't produce the movement, but the muscles are the ones that are actually producing the movement. But they're allowing for an area for the skeletal muscle to attach to help produce that particular movement. We also did a bone dissection, and we looked inside of bones, and we realized that bones store fats inside of them as well as minerals. The two minerals that are stored inside of bones are calcium and phosphorus. Fats in the internal marrow cavity of the bone itself. Also, bone is also a site of hematopoiesis, which is your red blood cell formation. Take a look at the adult skeleton. It has 206 bones. An infant has more bones because their bones haven't completely fused together yet. We take a look at the surface features of bones. They have some certain markings on the bones that we kind of have to know. What you guys have to know is, these processes are things that grow out from the bone. So processes or projections are these features that grow out of the bone. They often begin with the letter T, like trochanter or tubercle. Depressions or cavities or indentations in the bone, they often begin with an F, like a facet or a foramen. We took a look at the axial skeleton. I introduced that to you a little bit earlier. It forms the longitudinal axis of the body. The three parts of the axial skeleton are the skull, the vertebral column, and the bony thorax. We take a look at the actual skull itself. It consists of two sets of bones. We have the cranial bones and we have the facial bones. These bones are joined together by a particular type of joint that we call a suture. Remember, joints are areas where two bones come close to touching one another, or they touch one another. Those are joints. The particular bones of the cranium are called sutures. They fit together much like a puzzle piece does. They don't allow for hardly any movement at all. We take a look at your skull. The only movable bone on your whole entire skull is the mandible. That'll be on your test. So, get out my drawing tool here. So the major, you can see these are the sutures that are right here. These are sutures that are right here. They kind of fit together like a piece of a puzzle. But let's take a look at the actual cranium itself. This bone right here, towards your forehead, this is your frontal bone that's right here. They're labeled with an F. So that's your frontal bone. You have one frontal bone. So you have one frontal bone. You have two parietal bones. This green bone right here that I'm labeling with a P is called your parietal bone. So that's your parietal bone that's right there. Then here you have another bone that's called your temporal bone. So this is your temporal bone. Note that the temporal bone, guys, right here kind of forms this area right here that's called your zygomatic arch. So we call that your zygomatic arch that I just went over right there. So this was your zygomatic arch that's right here. Okay. But this is the temporal bone that I labeled with a T. That's the temporal bone. Back here, you have two temporal bones, one on each side. Back here, you have another bone that's called the occipital bone. And I'll label that with an O. So that's your occipital bone when we take a look at it. Some other interesting bones that you may not hear that much about is this pink bone that's right here. It looks like a bat wing. This is one side of the bat wing that's right here. It's called the sphenoid bone. I'll label it with an S. You have one sphenoid bone. But that sphenoid bone kind of looks like this. Let me grab a skull real quick. But here, guys, I have a human skull. This is a real human skull. Right here, guys, is the sphenoid bone that's right here. So sitting right here is the sphenoid bone that's right here. I'll draw on this because I'll be able to erase this. So it runs from here. So you can see I have that black mark there coming across here on the underside. And it comes all the way over onto the other side here. So when I say it looks like a bat wing, it's because it's sitting like this. Okay, because it's sitting like this. So you can kind of think of this as kind of like a wing. Kind of like this is what it actually looks. So that's what I mean by bat wing. When I take a look at the sphenoid bone that sits there. That's one bone that you may not know a lot about because a lot of your anatomy teachers don't go over that particular bone itself. You can see here, guys, this is the underside drawing here. You can see this is that sphenoid bone coming all the way around here. This is part of your cranium. You can see kind of the bat-like resemblance to it that I'm trying to get across. Hopefully I did a good job of explaining that to you. But that's that sphenoid bone. Another bone that we have that's part of the cranium itself is the ethmoid bone, and it's sitting right here. This is your ethmoid bone. It's coming in here, it's running down here, and then it's going to the other side over here. But that's your ethmoid bone. It's helped forming your actual cranium itself. Also helps form your ocular cavity. Some of the features on these bones that you have to know for the test. This ear hole that you guys saw when we took a look at the actual skulls themselves, and we had to identify who that individual is, that person that we found, and we had to do measurements on. This ear hole right here is called the external acoustic meatus. That's where sound's going to go into, and then that's going to go in there, and it's going to do your whole ear canal thing and cause vibration and things like that, but to allow you to hear. That's called your external acoustic meatus, so that's that hole that's located right there. You have a processus right here. Remember, processes are projections off of bones. This is called the styloid process. This is called your styloid process. So the styloid process is going to serve as an attachment point for a lot of muscles that are associated with your larynx and with your tongue. So this is going to have a lot of tendons that are going to attach to it, and then are going to be forming muscles and things like that. They're going to attach to your larynx and attach to your tongue. This right here is called the mastoid process. If I can go back, guys, the styloid process is called the styloid process of the temporal bone, because you also have a styloid process of your ulna and a styloid process of your radius. So if you want me to get really nerdy with you, I just did. But the mastoid process is going to serve as an area for attachment for muscles that are associated with your jaw, is what it's going to serve as an attachment for. So these muscles are going to attach right here, or these tendons are going to attach right here, and they're going to serve as attachment points for those. So that's called the mastoid process. As I take a look at the underside of the skull here, this right here, this giant hole where your spinal cord comes in, that's called your foramen magnum. So this is called your foramen magnum. Then we have some other holes here that you kind of have to know as well. This right here is your jugular foramen. This is where veins are going to drain back to your heart. Here are going to come out of here. So this hole right here, veins are going to be coming out of and going back to your heart. The holes just in front of the jugular foramen are called the carotid canal, and these are going to be serving your brain with a lot of blood. So this is bringing blood to your actual brain itself. These little resting points right here are called condyles, and this is where your skull is going to rest on. The C1 vertebrae is on those particular condyles itself. So you have the foramen magnum, you have the occipital condyles, you have the jugular foramen, and then you have the carotid canals as well. So we're going to take a look at bones of the face now. And this is the only movable bone of your whole entire face. I'm marking it with an M. It's called the mandible. You have one mandible. Your maxilla bone or maxillary bone is this bone right here that's in purple that's coming across right here. It's forming the upper portion of your mouth itself, coming around here. But you have two maxillary bones that I'm outlining right here, and I'll label them MA. You have your nasal bones that help form the bridge of your nose that are right up here. So those are your nasal bones that are there. This bone that's helping to form your cheek is called your zygomatic bone. Now if I take my zygomatic bone with the temporal bone, that arch of the temporal bone, it's what we call the zygomatic process. But that's your zygomatic bone. You have one on each side. That's forming your cheek. It also helps form your eye structure as well. Looking inside your eye, you have these little tiny bones that are sitting right here that tears drain down from. They're called lacrimal bones. So this is called a lacrimal bone. The lacrimal bone has little tiny grooves in it that help form your tear ducts that tears are able to drain into and then go into your nasal cavity. So when you cry, they're able to drain properly in the correct location. When I take a look inside the nose itself, you have these things that are called nasal conchae. So this is the inferior nasal conchae. These particular bones, what they serve a purpose as is when dirt and debris comes in your nose, you don't want it to come in real cleanly. So basically these bones are in your nose because they help stir up air, and they make the air more turbid, so things get trapped in the actual mucus itself and helps clean out that particular air. But those are called nasal conchae. So when I look at your inside of your mouth that we're looking at right now, right here's your maxillary bones. Back behind your maxillary bones, you have what's called the palatine bone. You may have heard of your soft palate. That's part of the palatine bone towards the back of your mouth. And then you have the vomer bone that's hanging out right there. So you have the palatine, and then you have the vomer. This vomer bone that I was just talking about also helps form part of your nasal septum. So it also helps form part of your nasal septum that divides your nasal cavity into a right nasal cavity and a left nasal cavity, or a right side and a left side, or a right nostril, a left nostril, so they are separated from one another. So when I take a look at the nasal cavity itself, you have these areas where these bones come together and they form hollow cavities. So you have these areas where these bones form these hollow cavities, and these hollow cavities around the nasal cavity are called your paranasal sinuses. These paranasal sinuses are going to help lighten the skull. They also are what gives your voice the ability to project and resonate. So you have that good voice, that quality voice, that amplification of your voice. And that's due to these paranasal sinuses allowing these hollow cavities for your voice to actually project themselves. Here's what your paranasal sinuses look like that you can see here. You don't have to know the names of them, but you kind of have to know that when I look at a paranasal sinus itself, another function of them that I didn't mention is these sinuses are also going to produce mucus, and this mucus is going to drain into your nasal cavity. So all of these have little tiny tubes that are going to drain into your nasal cavity. And the reason I tell you this is one of the reasons you get sinus infections or you get allergies or something like that. With a sinus infection, you basically have a virus that comes into play here and can get into your actual sinuses themselves. This little dot guy is a virus, And part of your viral response or immunity response to an actual virus is to increase blood flow to that area, so we can increase white blood flows flowing to that area. But what happens when you have this inflammation response is that these tubes get clogged up as a part of this inflammation response. Now you have this mucus that's building up inside of these sinuses and it can't drain. So your voice begins to talk like this when you get like a sinus infection. And that's because that you have this inflammation response that's occurring as a result of this this viral infection. Same thing comes if you have like an allergy. A lot of times you're allergic to something like plant pollen, which is basically sperm of a plant. And basically this pollen gets up in the sinuses, and your body sees that pollen as a foreign invader. So when this pollen's around in that sinus cavity, we increase the inflammation in that particular area. That's why you take an antihistamine. An antihistamine reduces that swelling and allows this mucus to drain properly. There is one bone of your skull that doesn't articulate with any other bone. It serves as a movable base for the tongue. It's called the hyoid bone. It's going to aid in swallowing and speech. Also serves as an area of attachment for your tongue. Reason I point out the hyoid bone is sometimes some of you guys are going to go into forensic science and things like that. And if any time I see that an individual has fractured their hyoid bone, that's a great indication that this individual has been strangled. But this is the hyoid bone. This is right underneath your neck is where that hyoid bone sits. Some differences between a fetal skull and a human skull is one of the major differences is these fontanelles. We call them kind of soft spots is what we have. And basically this is a fetal skull that you're taking a look at right here. But you can see that these sutures haven't fully formed on the actual baby skull yet. And this is to allow the baby to be able to pass through the birth canal. So when a suture forms, guys, it's not real movable, but having these fontanelles or these soft spots allows these actual cranial bones to move a lot better so they can fit through that birth canal. Other than that, the baby would go through that birth canal, and what would actually happen is you'd have a fracture of the skull. So that'd be a hard way to be brought into this world, is immediately you come into this world and you have a fractured skull. So that's why we kind of have these fontanelles to allow this cushion and this give of these actual these bones that are associated with the baby's skull. Taking a look at the vertebral column, remember the vertebral column, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. You guys should know that 7, 12, 5 number. You eat breakfast at 7 o'clock, you eat lunch at 12 o'clock, you eat dinner at 5. So you have 24 single vertebrae. And a vertebrae is separated by an intervertebral disc. So it goes vertebrae, and then you have a vertebral disc, which is that cartilage that we talked a little bit about, that fibrocartilage that we talked a little bit about when we talked about tissues a little earlier on in the year. Then we move down, and we have beneath the lumbar vertebrae, we have the sacrum and the coccyx. The sacrum and the coccyx don't have that vertebral disc in between them. They're basically vertebrae that have become fused together. So if we take a look up here, you can see this is your cervical vertebrae right here. We say they're C1 to C7. Then you have your thoracic vertebrae, your T1 to T12. Then you have your lumbar vertebrae, your L1 to L5. Then you have your sacrum, and then you have your coccyx. Remember, your sacrum and your coccyx aren't considered vertebrae because they don't have that vertebral disc in between them. They're basically bones that are vertebrae that have become fused together. But the sacrum consists of 5 fused vertebrae, and the coccyx consists of 7 fused vertebrae. All right, so this is just kind of a generic diagram of a vertebrae itself. This part right here is called the body of the vertebrae, and on the body is where this actual cartilaginous disc is going to sit. If I take a look right here, these are called your superior articular processes that are right here. And at the end of them, you have these little facets that are located here. But this is going to allow one vertebrae to kind of articulate with another vertebrae. And I'll show you that right here. So these are these 2 superior facets that I have. They're right here. But you can see there's kind of smooth there. And this is going to allow this vertebrae to attach with the next one right here, so they kind of touch like that when you take a look at them. Notice when these fuse together, guys, there's a hole right there. Through this hole, the actual spinal cord is going to run. The spinal cord is going to run through that particular hole itself. We have these other processes that are here, and these other processes are going to serve for areas of muscle attachment, like back muscle attachment and things like that. Some of these areas are going to serve as articulation points if it's a thoracic vertebrae, where your actual ribs going to articulate with these areas that are right here. So this process that comes out here is called a transverse process. This one coming out the back is called a spinous process. This other one here is another transverse process that's coming out here. These transverse processes have little facets that are located on them where ribs will articulate if you're part of the thoracic vertebrae. This hole is called the vertebral foramen. Remember, we had the magnum foramen that was in the skull. This is where your spinal cord is going to run through. So that's kind of the basic anatomy of a generic vertebrae. So when I take a look at at the actual shape of the vertebral column, you notice when you're born, the natural shape, the natural curvature is a C shape. So this kind of has a C shape on this particular baby itself. But as this baby grows and develops, this vertebral column becomes more S shape and allows us to become bipedal. This is one of the reasons why a baby can't walk right away, is because its spine's not the correct shape. So as this baby grows and develops, it becomes more S shape, and that allows it to become more bipedal. So we call this C shape, we call that the primary curvature. These are the spinal curvatures of the thoracic and sacral regions. This is present from birth. This forms a C-shaped curvature in newborns. And then as you grow and develop, you form your secondary curvature. And this develops after birth, and this forms an S-shaped spine, which is going to occur as you develop and makes you more bipedal. Some deformities that we can have with the actual spinal column, some are genetically based, and then some are lifestyle based that we can have. If we get this spine out of alignment, is basically what's happening. If it goes lateral, we call this scoliosis. So this is scoliosis right here. The second one that we have, this second disorder that we have is called kyphosis. And basically with kyphosis, you wind up with a hunchback. And this is where the spine's out of alignment. Lordosis a lot of times happen with people that are overweight or pregnant, something like that. And they get what's called a sway back, but you have a hollow portion right here in your spinal column itself. This is going to present your problem with having types of pain and things like that in your back, from running, movement, those different types of things. But you get a lot of back pain with these three particular types of disorders. Scoliosis can be genetic a lot of times. Kyphosis can be posture driven, and then lordosis can be weight driven. When we take a look at these three, this is kyphosis right here. This is what scoliosis looks like. A lot of times when you look at scoliosis, you know a person has scoliosis if you look at one scapula compared to the other scapula, and you can see that one tends to be higher than the other one. This is lordosis right here. That you can see this individual has this sway back right here. If you look right here in their back, you can see that hollowed out area in their back itself. Two interesting vertebrae to have a specific name that you have to know. The C1 and the C2 vertebrate. The C1 vertebrate is called your atlas, and the C2 vertebrate is called your axis. On your test, I'll ask you another name for the C1 vertebrate, and that's the atlas, and then the C2 vertebrate is called the axis. I think in like mythology, when you guys study that stuff in English, that they had like a mythological god that was named Atlas that held like the whole entire world on his back or on his hands or whatever. But Atlas, the atlas vertebrae, is holding up your skull, which is how they kind of got that name with it. There's your thoracic vertebrae, and then there's your lumbar vertebrae. We talked about the sacrum and the coccyx. The sacrum is formed by the fusion of 5 vertebrae. The coccyx formed from the fusion of 3 to 5 vertebrae. It's also called your tailbone. So this is your sacrum, and then you have your coccyx beneath there. We take a look at your bony thorax. Your bony thorax is going to form your rib cage. Is what it's going to form. It consists of 3 parts. You have your sternum, then you have your ribs. Ribs number 1 through 7 are called true ribs. Your false ribs are ribs number 8 through 12. And in particular, ribs number 11 and 12 are a specific type of false rib that we call a floating rib itself. These are all associated too with your thoracic vertebrae. So you have your sternum, your ribs, and your thoracic vertebrae. This is all going to form your bony thorax. So this is your sternum that's right here. Your sternum's divided into 3 parts that we have. This top part is called the manubrium. This middle portion right here is called your body. And then this little piece of cartilage right down here that kind of looks like a dagger is called your xiphoid process. So this is called your xiphoid process. So you have your manubrium, your body, and your xiphoid process are the 3 components of your sternum. Now we're going to go over our actual true ribs themselves. A true rib comes around. These are ribs number 1 through 7, and they attach directly to the sternum. So your first 7 ribs are called true ribs, and then we get to ribs number 8 through 12, and they're called false ribs because a false rib comes up and it doesn't have a direct attachment to the sternum. It comes up and then attaches to like a piece of cartilage that then leads to the actual sternum itself. So it doesn't have like direct cartilage piece that's attaching to the sternum itself. These ribs number 11 and 12 are called false ribs. They're called floating ribs, because they don't have any attachment to the sternum at all. A lot of times when you watch football and stuff like that, you'll notice that the quarterback can get sacked, and a lot of times this is the ribs that get fractured in those quarterbacks. Note that each rib has a vertebrae that it attaches to in the back. That's why you have your T1 through your T12. Females don't have any more ribs or less ribs than males. I know there's some misnomer out there that females have less ribs and males have more ribs, but that's not true. So we're now going to move into your appendicular skeleton, which is composed of 126 bones. It consists of your limbs, your arms and legs, your pectoral girdle, and then your pelvic girdle as well. So all these bones that we have in here that are not in blue are part of your appendicular skeleton. The good news is the same thing that's on the right side is on the left side, so that 126 bones should not scare you. Take a look at the pectoral girdle. It's also called your shoulder girdle. It's composed of 2 bones. You have the collarbone, and then you have the scapula itself. The clavicle is going to articulate with the sternum, and then medially, then laterally, it articulates with the scapula. The scapula is also known as your shoulder blade. The clavicle is also known as your collarbone. These bones allow for the upper limb to have exceptional free movement. So you can see here's the clavicle coming across. So this is the clavicle coming across right here. And then this is your sternum coming across all up here. This coming back here is your sternum. This is your scapula. You have your humerus. It's going to form the upper arm. It's a single bone. The head articulates with the glenoid cavity of the scapula. So that cavity in the scapula is called the glenoid cavity. When we take a look at the bone, I'll go through the anatomy of the bone a little bit later for you. But this is your humerus. Then we have the bones of the forearm, which consists of the ulna and the radius. Remember, the radius always follows your thumb. So where your thumb's at, your radius is running. Your radius is rad. Your ulna is going to go with your pinky. So that's your radius and your ulna. So you have your radius and you have your ulna. Your ulna also forms your elbow. Your ulna helps form your elbow. It's called the olecranon process, this right here. Take a look at the hand. Your wrist bones are called your carpals. You have 8 wrist bones. The palm of your hand is called your metacarpals. You have 5 metacarpals per hand. And then your finger bones are called your phalanges. You have 14 phalanges in each hand. Each finger, there's 3 bones. With exception to the thumb, there's only 2 bones that compose the phalanges. when we name the phalange bones, or we name your metacarpals or your phalanges, we start with a thumb being 1, and then 2, 3, 4, 5 as we come across. We take a look at the pectoral, or I'm sorry, the pelvic girdle. It's composed of 3 pairs of bones that fuse together. You have the ilium, the ischium, and the pubis. The pelvic girdle consists of the 2 coxal bones and the sacrum. The bony pelvis consists of the 2 coxal bones, the sacrum and the coccyx. So the coxal bones are these 3 bones fused together, the ilium, the ischium, and the pubis. Basically, the weight of your upper body is going to rest in this particular area. It also is going to protect your reproductive organs, your urinary bladder, and also parts of your large intestine. This is the coxal bone right here, and I'm going to show you this with a drawing here. Let me get out my drawing tool. So when I take a look at this, this is my coxal bone that's right here. So this thing coming all the way down here is my coxal bone that I take a look at. Okay, it's divided into 3 segments that are right here. This one up here is called my ilium. I'll put an I on it. This down here is called my ischium. So this bone right here is called my ischium. I'll mark it with an S. And then this one right here coming across here, I'll mark with a P as my pubis. But these 3 bones fuse together to form your coxal bone that's right there. Then I have my sacrum, and then I have my coccyx that's right there. Again, ilium, there's your pubis, there's your ischium, ilium, ischium, and pubis. Differences between a male and a pelvis and a female pelvis basically is when I take a look at these, I'm looking at the actual length of the false pelvis, and that's from the coxal bone to coxal bone. And a male, so in a male, this distance is a lot shorter than that of a female. That's one way I can tell the difference. Also, when I look at the pubic arch right here, if it's greater than 90 degrees, if I measure this with a protractor, if it's greater than 90 degrees, this is cluing me in that this is a female. If it's less than 90 degrees, then that's going to clue me in that it is a male. Also, the pelvic berm, the distance from here to here, is a lot shallower than that of a male itself. A female is a lot wider, I'm sorry. A female is a lot wider. A male is a lot not as wide when we take a look at it. So there's some difference between a male and a female. I expect you on your test to be able to identify a male pelvis and a female pelvis. You guys had a lot of work with this in class when we did the analyzation of those missing persons bones that that we found in the park and we were called upon to analyze. Femur is your heaviest, strongest bone in the body. You have the head that's going to articulate with the acetabular of the hip bone. The distal end is going to attach to the tibia. You have 2 large components of it. You have the head of the actual, this is the head of the femur. Then you have the greater trochanter and the lesser trochanter. These things down here at the end are called the condyles. And they have cartilage at the end of them to allow for easy movement and things like that can occur at that particular area. Then you have your tibia, which is called your shin bone. Then you have your fibula, which is lateral to the tibia. It doesn't form the knee joint, whereas your tibia helps form the knee joint as well. Up on top of this, guys, you're going to have the patella is going to sit. So you also have the patella, if I didn't mention the patella. Moving down, we have our ankle bones, which are called our tarsals. There's 7 ankle bones. The 2 largest tarsals are called the calcaneal bone and the talus. Then you have your metatarsals, which are 5 bones that form the sole of the foot. Then you have your phalanges, just like you have with your hand, 14 bones. The only one that's not composed of 3 is going to be that of your thumb toe, I guess is what we would call it.